According to the U.S. Census Bureau, the current total population of Native Americans in the United States is 6.8 million, which is about 2.09% of the entire population. There are about 574 federally recognized Native American tribes in the United States. Native Americans account for more than 10% of the population in Alaska, Oklahoma, New Mexico, and South Dakota. About 4.5 million individuals of the U.S. population self-identify as American Indian or Alaskan Native descent. Of these, an estimated 2 million are eligible for federal services. About 50% of American Indians live on reservations or other U.S. Census-defined tribal areas. Today, Native Americans still face threats from federal and state governments related to land use and resource extraction. Native Americans have the highest poverty rate of any major racial group, with 1 in 4 people living below the poverty line. The Indian Health Service, or IHS, carries out the federal government's trust responsibility to provide federal health care services to Native Americans. More than half of the Indian health programs are contracted from IHS and operated by tribal organizations. The IHS estimates that historically, annual congressional appropriations have only met 52% of American Indian and Alaska Natives' healthcare needs. 24% of Native Americans lack health insurance coverage and rely solely on the Indian health system. American Indian and Alaskan Native adults are more likely to be in fair or poor health than all U.S. adults within each level of urbanization and among the total population. American Indian life expectancy at birth is 5.5 years less than the general U.S. population. An indicator of a society's health is the maternal mortality ratio, or MMR, which is maternal deaths per 100,000 live births. Gaping disparities exist in U.S. maternal mortality between white and minority women. The CDC shows an overall pregnancy-related mortality ratio, or PRMR, of 12.7 for white women and 29.7 for American Indian women, revealing a persistent racial and ethnic disparity. While infant mortality rates declined for all racial and ethnic groups between 1984 and 2004, babies born to American Indian mothers have relatively high infant mortality rates. In 2004, the infant mortality rate for American Indians was 9 infant deaths per 1,000 births, which was higher than the rates for whites, Hispanics, Asians, and Pacific Islanders. Adequate prenatal care improves perinatal outcomes, yet about 13% of American Indian and Alaskan Native women receive third trimester initiated care or no prenatal care, compared to 4.5% of white women. In urban settings, these vulnerable women received late or no prenatal care at twice the rate of all other women combined. This may be explained partially by barriers they already experience, such as lack of health insurance or reliable transportation. Poor understanding of Native American culture and inability to tailor care to the unique needs of these women are provider characteristics that negatively impact prenatal care quality. Native American women report such negative provider experiences as disrespect and being stereotyped as drunks and drug users. The inability to see one provider throughout pregnancy, providers that seem too busy to address concerns, and hearing negative stories from others are additional barriers. As current registered nurses and future APRNs, it is vital that we recognize, celebrate, and encourage the rich cultural beliefs of Native American women and families. We must be advocates for their health needs and be prepared to offer resources and services that will promote healthy living and adequate prenatal care. In doing so, we play a monumental role in diminishing health disparities and supporting healthy babies and strong families.